to complete the contact tracing process on a war footing. Centre says that the spike in COVID-19 cases due to travel by members of Tabhlig Jamaat, all the 2,300 occupants of Delhi's Tabhlig Jamaat headquarters evacuated and sent to quarantine. Over 100 of the participants at the Tabhlig congregation test positive. Number of corona active positive cases in the country stand at 1,466, while death toll goes up to 38. 132 persons have been discharged after recovery. Reserve Bank of India announces further measures for dealing with COVID-19 pandemic. Realization period of export proceeds extended to 15 months. And as countries grapple with the coronavirus crisis world over, its intensity weakens in the West, Italy and Spain, while it intensifies in the US. Total confirmed cases across the world crosses 8.6 lakh. Death toll rises to 42,000. Hello, you're watching DD News and I'm Preeti presenting the bulletin. Our top story first. Briefing the media on the latest updates on COVID-19 situation in the nation. The centre has said that till now there are 1,637 COVID-19 cases, including 386 new positive cases since yesterday, while 132 people have recovered. The centre has said that the number of positive cases has gone up since yesterday. The main reasons for it is the travel by members of Tabhlig Jamaat.
1,800 जो लोग हैं जो दिल्ली में इस तबलीगी जमात से रिलेटेड जो लोग थे उनको 9 हॉस्पिटल और क्वारंटाइन सेंटर्स में शिफ्ट कर दिया गया है। मैं ये हाईलाइट करना चाहूँगा कि जो भी ये नंबर इंक्रीज हुआ है पिछले कुछ दिनों के कंपैरिजन से देखें तो ये एक नेशनल ट्रेंड को रिप्रेजेंट नहीं करता, बट डेफिनेटली ये हम सबको पता है कि अगर कोई भी हमारी कोई कहीं पर भी फेलियर होती है तो केसेस बढ़ना स्वाभाविक है। इसके तहत ही मैं फिर सभी से ये कहना चाहूँगा कि लॉकडाउन की परिस्थिति में हमारा यथासंभव प्रयास, हमारे जो इंस्ट्रक्शंस हैं, हमारी डायरेक्शंस हैं, वो यही हैं कि किसी भी तरह का कांग्रीगेशन अवॉइड करना चाहिए, धार्मिक सभाओं को अवॉइड करना चाहिए।
So far, 47,951 cases have been conducted till date. There are 126 labs in the ICMR network, including 51 private labs that have been approved. As many as 6 lakh people are living in the makeshift camps.
स्टेट्स और यूटीज़ में लगभग 21,064 माइग्रेंट वर्क रिलीफ कैंप्स सेटअप किए गए हैं और इन रिलीफ कैंप्स में लगभग 6 लाख से अधिक, अगर मैं एग्जैक्ट फिगर कोट करूं तो 6,66,291 लोगों को शेल्टर की सुविधा दी गई है। इसके अलावा लगभग 23 लाख लोगों को भोजन की भी सुविधा प्रदान की गई है। ये सुविधाएं जो पुअर और डेस्टिट्यूट है उनको उपलब्ध हैं, ये स्ट्रैंडेड माइग्रेंट वर्कर्स को भी उपलब्ध है, ये उन वर्कर्स को भी उपलब्ध है जिनको सिर्फ भोजन की आवश्यकता है, और ये सुविधाएं उनको भी उपलब्ध हैं जो अपने गंतव्य स्थान पर पहुंच गए हैं लेकिन सेल्फ स्टैंडर्ड हेल्थ प्रोटोकॉल के अनुसार क्वारंटाइंड हैं।
The Tabhlig Jamaat Workers in Nizamuddin West, which is among the major COVID-19 hotspots in the country, has been cleared after the evacuation of 2,361 people in the past 36 hours. Delhi Deputy Chief Minister Manish Sisodia informed in a tweet. Out of 2,361 in the building, 617 who had symptoms have been taken to hospitals, while others have been quarantined. The government launched 36-hour-long operation to empty the markers and desanitize it later with the help of police, medical staff and municipal workers. The government has maintained that it is committed to identify, isolate and quarantine COVID-19 positive Tabhlig Jamaat workers in India. Home Ministry released a statement yesterday over Tabhlig Jamaat issue, stating that on March 21st, the MHA was prompt to share details of Tabhlig Jamaat workers, which included foreign nationals in India, further stating that this information was shared after COVID-19 positive cases surfaced in Telangana. Union Home Ministry acted swiftly on 21st of March itself, sharing the details of foreign and Indian Tabhlig Jamaat workers in India with all the states. The swift action was taken with a view to identify, isolate and quarantine Tabhlig Jamaat workers who might be COVID-19 positive. Instructions were also issued by the MHA to Chief Secretaries and the DGPs of all the states as well as CP Delhi. The advisories were reiterated by the DIB to all state DGP on March 28th and 29th. Meanwhile, workers staying in the markets in Nizamuddin were also screened. So far, 1,339 Tabhlig Jamaat workers have been shifted to 3 quarantine facilities as well as to the government hospitals in the capital and also AIIMS Jhajjar. The rest of them are currently being medically screened for COVID-19 infection. The Delhi police has lodged an FIR against Maulana Saad and others for violating government directives. Tabhlig Jamaat Workers is located in Nizamuddin in Delhi. Devout Muslims from across the country and also from foreign countries visit the markers for religious purposes. Some also move out in groups to different parts of the country for Tabligh activities. On March 21st, approximately 824 foreign Tabligh Jamaat workers were in different parts of the country for missionary work. Besides, around 216 foreign nationals were staying in the markers. The Cabinet Secretary took a meeting today by video conferencing with all the Chief Secretaries and DGP of the states. The states were sensitized about the intensive contact tracing of Tablighi Jamaat participants, as this has increased the risk of containment efforts of COVID-19. The states were asked to complete the contact tracing process on a war footing. It has been found that foreigners who had participated in Tablighi Jamaat had violated visa conditions. The states were asked to initiate action for violation of visa condition against the foreigners and the organizers of the event. Further, the states were asked to implement the PM Garib Kalyan Yojana within the next week. Now, this will involve large cash transfers to the beneficiaries. It should be organized in a staggered manner to ensure social distance. It was noted that lockdown is being implemented effectively all over the country. The states were asked to ensure that intra-state movement of goods is allowed without any hindrance while maintaining social distance. The manufacturing of essential goods should be ensured. It should also be ensured that the supply chains of such goods are maintained. And as the nation enters the 7th day of the lockdown, the active cases of COVID-19 has reached 1,466. 132 people have been cured from the disease, while 38 have succumbed to coronavirus infection. Ministry of Health is working in close coordination with states in tracing the contacts of the coronavirus patients in the country. A high-level meeting of the group of ministers on COVID-19 was chaired by Union Health Minister Dr. Harshvardhan in Delhi. Minister of External Affairs Dr. S. Jaishankar, Minister of Civil Aviation Hardeep Singh Puri, Minister of State for Home Affairs Nityanand Rai, besides other ministers and officials were present at the meeting. The group of ministers reviewed the current status, actions and preparedness of the states and union territories for management of COVID-19. The group of ministers also discussed the need for each state to set up exclusive hospitals for COVID-19 patients. A Science and Technology Empowered Committee for COVID-19 Response has been constituted and chaired by Professor Vinod Paul, member Niti Aayog and Principal Scientific Advisor to the Government of India, to coordinate amongst the science agencies, scientists, industries and regulatory bodies. The committee will work with Department of Science and Technology, Department of Biotechnology, Council of Science, Scientific and Industrial Research, Defence Research and Development Organization and the Indian Institute of Science to take speedy decisions on research and development, keeping in view the critical need to increase the testing facilities for COVID-19 disease. In view of the Supreme Court's decision regarding COVID-19, Ministry of Home Affairs has issued the Apex Court's guidelines to organizations associated with the print and broadcast media. Union Home Ministry has asked the Ministry of Information and Broadcasting to convey the decision to all the stakeholders. The stakeholders include News Broadcasters Association, Press Council of India, Indian Broadcasting Foundation, Prasar Bharati, Press Information Bureau and Registrar of Newspapers for India. With the spread of COVID-19 in the country, the Supreme Court has directed media to refer and publish official version about coronavirus developments. The Apex Court mentioned that there will be no interference regarding any discussions about the coronavirus. The Apex Court also mentioned that media should maintain strong sense of responsibility to avoid panic through unverified news. It also directed the government to clear doubts regarding COVID-19 through a daily bulletin. And in the wake of economic fallout experienced due to coronavirus outbreak in the country, the Reserve Bank of India has announced some measures to deal with the existing scenario. The central bank introduced measures including extension of period for realization and repatriation of export proceeds, in which the current value of the goods or software exports made by the exporters is required to be realized fully and repatriated to the country within a period of 9 months from the date of exports. In addition to increase in ways and means advances limit by 30% from the existing limit for all the states and union territories, which will come into force with effect from 1st of April this year and will be valid till 30th of September this year. And lastly, the implementation of counter-cyclic capital buffer put in place in terms of guidelines issued by February 5th, 2015, wherein it was advised that the guidelines would be activated as and when the circumstances warranted, and also the decision would be normally be pre-announced. And in this period of lockdown, banks have given some concession to the customers with regard to the EMIs. Our correspondent Ajay Mishra enlightens us on the steps taken by the banks on lessening the burden of the EMIs on the customers.
3 months moratorium on the payment of EMIs have raised so many questions. I will try to answer some of them in next 1 to 2 minutes. First of all, this facility is available only for the public sector banks and private sector bank borrowers. It is not applicable for those who have taken loan from any housing finance companies or non-banking financial company. That's point number one. Secondly, if you are a borrower who is paying EMI, you will not have to pay EMI just for 3 months. Your loan tenure will extend for 3 months beyond your loan tenure. That is point number two. If you are an industry person and if you are just giving your interest rate, your interest component, you may choose not to give it for next 3 months, but after the completion of 3 months, you will have to pay all the interest at one go. It is now up to you whether you want to continue paying it every month or you want to give it at the end of the 3 months. If you are a retail customer, it is advisable for you to go to your bank and actually ask the respective guidelines for that. And it is suggested that if you are in a position to pay the EMIs, please continue paying the EMIs. This facility is for those who have the cash crunch and who are not having any kind of cash flow because of the COVID-19 lockdown throughout the country. So it is advised that if you are in a position to pay the EMI and interest, please keep on paying. The only relaxation for you is that the EMIs and the interest and principal has been deferred for 3 months, and there will be no impact on the credit history. So the things will not be reported to CIBIL. That is the one positive things. But if you want to avail these facilities, you just have to follow the instruction from your respective banks. Ajay Mishra, DD News, New Delhi.
And all the COVID-19 cases have grown faster over the last 1 week. The transmission rate in India is lower than elsewhere, the experts have noted. A comparison of the growth in cases, deaths between India and the other countries, this is being put on your screens. Rate in India remains significantly lower than the global rate. On March 19th, every positive case in India was transmitting the virus to 1.7 people on average. By March 26th, that number had risen to 1.81, but remained significantly lower than in countries such as Iran or Italy, according to the Institute of Mathematical Sciences in Chennai's scientist Sitabhra Sinha. Now, for comparison, a study in the Lancet estimates the global transmission rate of COVID-19, the number of persons infected by every positive case, to be between 2 and 3. In India, despite overall rise in numbers, this rate remains significantly low at 1.8. And if anyone loses their life while serving any COVID-19 patient, be it sanitation workers, doctors or nurses or any other staff, temporary or permanent, from private or government sector, their family will be given ₹1 crore as the mark of respect for their service. Now, this was stated by Delhi Chief Minister Arvind Kejriwal during a media briefing in New Delhi today.
हमारे कोरोना पेशेंट्स की सेवा करते हुए, चाहे कोई सफाई कर्मचारी हो, चाहे कोई डॉक्टर हो, चाहे कोई नर्स हो, चाहे किसी भी कोई भी कर्मचारी, अगर चाहे प्राइवेट में हो चाहे सरकार में हो, कोई भी कर्मचारी अगर कोरोना पेशेंट्स की सेवा करते हुए कोरोना की वजह से शहीद होता है तो उसके परिवार को दिल्ली सरकार 1 करोड़ रुपए की सम्मान राशि देगी.
And Karnataka government has launched a quarantine watch app. Now, the app is for the quarantined patient who must send selfies to the government on hourly basis for monitoring their health status. The pictures sent on this app will be strictly protected and will be used by the doctors only.
With the implementation of strict lockdown advisory in Bangalore, the city which was once known as Pensioners' Paradise and Garden City, the chirping of birds can be heard clearly here. But the government is maintaining strict vigilance on those who are quarantined. Unfortunately, the saga of those who attended the Tabhlig Jamaat congregation at Delhi also links with South India and has reached Bangalore also. Over 53 people from Karnataka attended this congregation, and Karnataka government has been able to track 13 people who were part of this Tabhlig Jamaat congregation, and they have been quarantined medically. Now, the government has come up with strict advisory and warned those who have been medically quarantined and are home quarantined, they should send hourly selfie to the government, because this selfie is monitored by the government medically, since it has coordinates of the patients who are staying in their homes, and the government can monitor them on hourly basis. And the government has warned that those who do not send their selfie on hourly basis will be sent to mass quarantines. So the government is taking strict measures to monitor the quarantine people medically. And on the other hand, Karnataka government has also asked the doctors and medical students to register and offer services in the time of crisis. Many students and doctors are registering to come forward and help and counsel people not only fight coronavirus but also help people dispel their fears about common cold and fever as well. The government is implementing strict measures across the state and says that people who do not follow the strict advisory given by the government will be sent to mass quarantines. And the government has already warned that if the state does not follow the lockdown measures strictly, the government will not hesitate to extend the lockdown in the state. Aisha Khanam, Bangalore, DD India.
The nationwide lockdown to curb COVID-19 spread seems to be working well, as Rajasthan did not report a single positive case in the last 24 hours. Rajasthan has 76 active COVID-19 positive cases, including 2 Italian nationals. 17 Indian evacuees from Iran have been tested positive so far. Total positive cases in Rajasthan stand at 93, with 76 active cases. And as the state of Assam enters in the list of COVID-19 infected states with its first positive case detected on Tuesday, the state government is emphasizing much on strong enforcement of social distancing norms across the state. Assam Chief Minister Sarbanand Sonowal has clearly said yesterday that there will not be any relaxation in the lockdown in the state amidst many speculations. All-round efforts can be seen on part of the state government to deal with the pandemic.
There will be no relaxation in lockdown, and this will remain till 14th April as decided nationally. And this was the clear message from Assam Chief Minister Sarbanand Sonowal yesterday amidst many speculations over the issue. As the state detects its first positive case yesterday in Borak Valley, right now the process is on to bring all other persons who took part in the Jamaat in New Delhi a few days back under quarantine as much as possible. Right now, we have seen that Assam government is leaving no stone unturned to fight against COVID-19. If we talk about preparedness, yes, the state is ready with 4,000 bedded quarantine facilities along with many upcoming dedicated hospitals to deal with COVID-19. If we talk about supply of essential commodities, yes, the state government is taking all measures to get supplied all essential commodities to each and every household. We have seen that free rice, free pulses are being distributed for the poor. And this is how the state government is dealing with this COVID-19. With camera person Hawk, Kamal Bora reporting for DD India.
And 25 women auto drivers in Thane are serving those who want to reach hospital due to medical emergency. Now, these women auto drivers help pregnant women, dialysis patients and elderly patients to reach hospitals and also offer these services free of cost to women. With the approval of the district magistrate, a helpline number has been issued by the Thane RTO for rickshaw on demand in Thane city. The helpline number is 9967312176. I repeat, 9967312176. Now, this service is available between 10 a.m. and 5 p.m. daily.
कोरोना वायरस का संकट पूरे महाराष्ट्र पे या पूरे देश पे आया है और ये इसमें रुग्ण जो इमरजेंसी है जिसमें डायलिसिस करने जाना है, जिसको ब्लड चेक करने जाना है, जिसका रूटीन चेकअप है, इसलिए हमने हमारे पालक मंत्री एकनाथ शिंदे साहब और लोंडे साहब और सूर्य मामा के इनके माध्यम से इनके समझने से हमने एक व्हाट्सएप ग्रुप तैयार किया है और ये व्हाट्सएप ग्रुप पे हमको मैसेज आता है, वैसे हम लोग रुग्ण के पास जाते हैं, उनको हॉस्पिटल पहुंच जाते हैं.
And gurdwaras may be seeing fewer devotees due to the lockdown, but their age-old tradition of offering langar to the poor and homeless at the times of crisis are being followed religiously. One such gurdwara in Amritsar is serving food round the clock to feed the poor, including labourers and stranded people due to lockdown. The gurdwara offers langar to around 10 to 12,000 people on a daily basis while maintaining preventive measures like sanitation, hygiene and social distancing. People serving food also wear masks and gloves to avoid any social contact. And India today welcomed the announcement by the government of Afghanistan about formation of a team for intra-Afghan negotiations. Afghan President Ashraf Ghani formed the team weeks after signing of the peace agreement. India called the formation of the team as a positive step which would lead to peaceful and stable future of Afghanistan, free from externally sponsored terrorism. India also called upon all sections of the political spectrum in Afghanistan to work together to meet the aspirations of all people in that country, including those from minority community, for a prosperous and safe future. And more than 40,000 people have been killed in the coronavirus pandemic as the disease barrels across the globe, with the US bracing for its darkest hours after its death toll surpassed China's on Tuesday. US President Donald Trump warned Americans that they would have a very tough 2 weeks coming in the fight against coronavirus. During a news conference at the White House, Trump urged everyone to follow federal social distancing guidelines through the end of April. He said that the next 2 weeks would be very painful. More than 4,000 people have died from COVID-19 in the United States. And our correspondent Jagruti Dave files a report from the United States.
Sunday, the Coronavirus Task Force gave a briefing at the White House, and there President Trump announced that the social distancing guidelines in the United States would be extended until April the 30th. And this is a huge difference from the dates that President Trump had previously suggested. He had said that the economy could possibly reopen by Easter, but that is clearly not going to be the case. He accepted figures put forward by a member of the Coronavirus Task Force, Dr. Anthony Fauci, one of the US's top experts on infectious diseases. And Dr. Fauci had given a television interview earlier on Sunday where he had said that between 100,000 to 200,000 Americans could die of the coronavirus. President Trump at this briefing acknowledged those figures, but he also said that the figure could be higher, that citing a study saying that 2.2 million Americans could possibly die of the coronavirus if the government did nothing to mitigate the spread. And so clearly these figures have factored into the decision to extend the social distancing guidelines to the end of April. President Trump did say, however, that the United States could be well on the way to recovery by June the 1st. But he did say that he didn't foresee relaxing the guidelines anywhere in the United States before the end of April.
All right, that's it in this edition of the News Sisa. Thanks for watching. Bye-bye.